Hello, and thank you very much for watching this video on research for student nurses, pain points and myths. My name is Dr. Chiara Dall'Ora, and I'm a registered nurse and researcher. And today I will take you on a quick journey to address some of the challenges you might be experiencing when it comes to research. Let's look at the first one. Research has nothing to do with practice, and I did not come into nursing for the research. Let me tell you, very few people come into nursing for the research. I certainly did not become a nurse thinking that research would be my career. I came into nursing because I wanted to improve people's lives. And to my surprise, during my research courses back at uni, I found out that the aim of research was exactly the same of nursing, to improve people's lives. I was fascinated by the opportunity research offered to know reality better, to understand how things work, and how to improve care for patients. Hopefully, through this series of videos, I will persuade you that the research has a lot to do with the practice. We hear a lot about evidence-based practice, meaning that evidence produced by research shapes or should shape practice. Think about this scenario. You are on placement in the community and are about to visit a person with a stage 4 pressure ulcer. You read the protocol in your organization and notice that the treatment plan differs to what you have learned at the university. So which is the correct one? What treatment should you give to your patient? This is where research comes in. If you can find the best evidence around stage 4 pressure ulcer treatment, then you have something to base your practice on. Second point, as student nurses, we have to juggle too many different things to have the time to read research. That is certainly not a myth, it is very true. But once you learn how to read a paper, reading research can become much less time-consuming. During this series of videos, I'm hoping to teach you how to read a paper with a head-first approach. What should you look for to understand whether a paper is good or not so good? And what important information should you retain from a paper? Another tip, if you have a research question and limited time, is to look for a good systematic review in the first instance. I will tell you more about systematic reviews, but in a nutshell, a systematic review is a collection of studies on the same topic which have been brought together to answer a research question. It means someone else had your same research question and went into the literature to find existing studies to see if, by combining these studies, an answer could be found. This saves you time from having to collate all the different studies yourself. You can also look for lay summaries of existing studies or reviews. These are often published by Nursing Times or Nursing Standard and are usually 2-page long and have no research jargon. Number 3, finding a gap in the literature is challenging. How do we make sure our questions are relevant today? My main advice is, when you have a research question, break it down into blocks and do a quick search in your favorite search engine. It could be CINAHL or Medline, and see what you find. Is there a recent systematic review that looks at exactly your research question? If yes, that might indicate that there is no gap at the moment. Let's think about this example. You want to find the best intervention available to improve medication adherence in older people with multimorbidity. So let's break your kind of long question into smaller chunks and put it in our search engine. We would have as a chunk medication adherence and multimorbidity and older people. From the results, is there a recent systematic review that is looking at this? There might be, but have a quick look at the studies that are summarized by that review. For example, you might notice that the studies were done in the US, where access to medicines is very different to the UK, which means your question today in the UK might still be very relevant. Lastly, I would suggest you talk with those directly involved, in this case, with patients with multimorbidities. You might find that this group of patients is happy with their medication adherence, and hence your question is not relevant to them. Point 4. Surely a paper older than 5, 7, or 10 years old is not going to be relevant today. I would really like to challenge this stance that is so often taught during research courses, and suggest a head-first approach instead. Always ask yourself what the topic of your question is. Has it changed substantially in the past 10 years? In some cases, you might find that research even 2 years old can be very outdated. Think about research on interventions to prevent COVID-19 transmission. The evidence around this topic has evolved very rapidly. Always ask yourself, has my topic or the practice I'm investigating changed substantially recently? If so, when? That might be your cutoff. At the end of the day, what really matters when judging the quality of a paper is how a study was conducted. And of course, I will tell you more about that throughout this video series. Last but not least, there are too many difficult terms in research. How do we navigate this complexity? I feel research is for smart people only. Research might be for smart people, but I can assure you that if you're doing a nursing degree and are passing your exams, you are smart. The most important quality when doing research is curiosity and having what we call critical thinking, which means asking yourself the right questions and having a head-first approach. Research is not a series of checklists or rigid rules. It is really all about asking questions in front of what you read. You are right, though. Sometimes we use terms that are complex and difficult to understand. In this video series, I will do my best to explain what these terms mean so that you can understand them. And this should make things easier. I also want to reassure you that it is okay not to know everything about research. I also know some methods better than others. And when I'm using methods I'm less familiar with, I always go back to my research textbook and ask a colleague who has that expertise. I hope you will want to join me on this journey towards making research more digestible and relevant using a head-first approach.